Well, hello and welcome to Ask the Doctor. My name is Jerry McGee and I'll be your host of today's show. We're here in Pittsburgh, Pennsylvania at Wellness Associates with Dr. Eugene Goldberg. Dr. Goldberg, thank you very much for being with us today. On today's show, we want to talk a little bit about the cervical curves that we have, the sleeping patterns. We've had a lot of questions on these cervical pillows. We've had a lot of people say that they're basically not sleeping well. They're waking up with, neck pain and upper shoulder pain. And they really had a lot of questions on, is there benefit to these cervical pillows that we're seeing a lot of publicity on? And how does that impact, the cervical region, our level of sleep, and just basically having a better night's rest all over and waking up, kind of rejuvenated versus how they're waking up right now.
Just so you know, to comment on that, if you're having trouble sleeping, that means you have spinal cord pressure. That means you have the bones out of position, pressing on the nerves, which can cause pain. You can't get comfortable. It's affecting the functioning performance of the cells, the organs, and muscles. The best way to sleep, Jerry, is you sleep on your back with a contour pillow. Now, this isn't a contour pillow. This is just a model. So if you're going to be on your back and you lean into that, what that does is that puts you into extension. You have extension in your neck, extension in your low back, 43 degrees. You have three curves, the good curves in your back, okay? So if you use the contour pillow, you're going to be more comfortable. You're actually giving yourself a treatment for a third of your life. Because what this is going to do, let's say somebody's been in a car accident. The average person has been in one car accident per lifetime. Usually what that does is it traumatizes your spine. And you get a sprain, strain to the ligaments, the tendons, and you lose your curve. So instead of having a 43-degree C curve, you lose that. You have a military neck. You have a 5, 6, 7, 8-degree curve. Or sometimes people have a reverse curve, which is even more serious. They've done studies that all the nerves in the whole body go through the neck. So when you lose your curve in your neck, you lose your shock absorber, and that affects all the nerves coming down through the neck. In fact, all the nerves in your whole body go through the neck, including the vagus nerve, which is a cranial nerve that comes down from your brain and goes throughout your whole body, goes through all your organs. They call it the wandering nerve. So that can be a serious thing when you lose your curve.
So if we're talking, and I know personally, I've gotten away where I do sleep with a cervical pillow. If you notice, when I'm laying in bed, I'm pretty well straight.
Good.
Now, my wife, on the other hand, sleeps with several pillows.
Not good.
Okay? And, so basically, even if you were laying on your back, your neck would be, could be up like this, or if you're on your side, your neck is like this. So if you could just, in layman's terms, explain to our viewers, by being in that position with that amount of stress on your neck, night in and night out, 8 hours a night, whatever, the impact that has overall.
Just to keep it simple, when you're sleeping, you want to have your neck in extension. When you're using 3, 4, 5 pillows, what that does, Jerry, that throws your neck forward. It puts it into kyphosis. You don't want that. So you have a kyphotic curve in your mid-back. That's normal. The neck should be lordotic. Okay, so lordotic, kyphotic, lordotic. Okay, now if somebody in the low back, if they have too much curve in the low back, what they want to do is they want to put a pillow underneath their knees and sleep on their back. So a lot of people, what happens is they have too much curve in their low back, not enough curve in their neck. So you want to sleep on your back with a contour pillow. If you have too much curve in your low back, you want to put a pillow underneath your knees. And that's the best way to sleep.
So really, when somebody comes in for an evaluation, if you, and I know you do this, but if you were asking them questions about, how they sleep, what's their, when they wake up, what position are they in? Because normally our body's going to compensate.
Body always compensates.
Right, throughout the night. So really, that little story of how we sleep and what position we're in really tells a lot about, why we're having problems that we're having.
So you spend a third of your life sleeping. So if you're doing it wrong, that's affecting you for a third of your life. Okay, so that can be a serious thing. Just like if you're sitting on your wallet for 8 hours, that causes an imbalance in your hips and your pelvis. That causes an ischial lift on that side. That makes all your muscles weak on that side. So like a little things that you do every day, sleeping in your work environment, has an effect on your health, definitely.
And again, I think it gets, because we've talked about this on many shows, but I don't think we can state it enough. The person that wakes up with that neck stiffness, upper shoulder pain, and their method of treatment is go to the medicine cabinet, take some Tylenol, take some Motrin, whatever, okay? That we really need to get down to the root of that problem versus treating that feeling you have when you wake up in the morning. I mean, the medication's never going to change that cycle.
I've been doing this close to 30 years. A lot of people that come in the office, they're having symptoms, they're having pain in the neck, the back, the shoulder. A lot of them don't have a good curve. They don't have a 43-degree perfect architectural curve. So what you want to do is you want to adjust them. You give them an adjustment with the activator or the impulse. And what this does is sets the joints into motion from a posterior to anterior perspective. And this puts the curve back in your neck. Okay, and so once you get the curve back in the neck, what that means here is you have your shock absorber. Think of it like a car. If you lose the shock absorbers in your car, everything you do is going to rattle your car. So if you lose the shock absorber in your neck, if you lose your curve, you want to get it back, because if you don't, everything you do rattles your neck.
I think this is stuff that, and again, I think it's important to understand that what we do outside, when somebody comes here, you can do great work here. Right? You can do the adjustments, you can kind of get things lined up. But if they're not following through and having an active role in their own health,
definitely,
things aren't going to change.
Yeah, if they're sleeping on their stomach, a lot of people tell me they sleep on their stomach, and I say, let's stop right there. You don't want to sleep on your stomach anymore, Susie. You want to get the contour pillow, use it in extension. Otherwise, you're hurting yourself. Why would you want to do that? That's how they get into trouble maybe in the first place. They slept on their stomach. What that does is hyperextend your low back. You end up with low back pain, and you lose the curve in your neck, and then you end up with neck pain. So what we want to do is we want to flip them over, put a pillow underneath your knees, sleep on your back. That takes the pressure off your low back, and then give you a contour pillow for your neck, and you're giving yourself a treatment for a third of your life.
Yeah, I think that's that's critical for everybody watching this to understand, is that what we do outside of the visit here, how we the active role we take in our health, critical. We talk a lot about nutrition, critical. Our health is really about all these things coming together. It's not one individual thing.
It's not one cause, one cure. It's many causes, many cures.
Right. It's everything that's involved with our life. So if you're watching this and you find yourself in that position, maybe you're sleeping with 2-3 pillows, you're noticing neck pain. One thing I always encourage on this show, Dr. Goldberg here at Wellness Associates offers a free patient evaluation. Come down, meet Dr. Goldberg, see the facility, see what they have to offer, let them do an evaluation and explain to you how this is impacting your overall health. And I don't think people realize that when they have these kind of problems, it's not only affecting their neck, it could be affecting other things. Maybe they've got, allergies, asthma, sleep apnea, which we're going to talk about on a future show. These types of things that are really impacted by what we've just talked about.
Why? Because you live your life through your nervous system. Your nervous system's wired to your immune system. So when you help your nervous system, you're helping your cells, your organs, and your muscles, and you affect the functioning and the performance of your body. What a concept, Jerry.
Yeah, it's and that's why I love doing this show, and I love coming down here and talking to you, because these things are, a lot of the stuff we talk about are simple things that people can do.
Yes.
Not complicated stuff, simple steps. Looking at different ways to maintain your health and improve your health. And what I would stress here as we wrap up on today's show is it's never too late to start. And no matter what state you're in right now, come down. You have to get started somewhere. Getting started is always the hardest step.
Where there's life, there's hope.
Right. You got to take the first step. And that first step is picking up the phone, calling Wellness Associates, come on down, meet the staff, let Dr. Goldberg show you firsthand what he can do and the impact it can have on your health. We hope you're getting a lot out of these shows. We got a lot of great episodes coming up with some specific problems that I'm sure you're going to want to watch. And again, if there's any specific questions that you have, visit the website at AskDrGoldberg.com. There's an area where you can enter in your question. We'd be happy to address that on future videos. Or more importantly, just pick up the phone and come on down. I think that's a great step, and learn more about how chiropractic care can have a positive impact on your health and get you towards those goals that you have. So thank you very much for watching this show. Appreciate your time today, and we look forward to seeing you on our future episodes. Have an awesome day.